Hi, good morning. My name is Garnet Gilmore. I work for Riverside Health System, and myself and Alan Varnson will be presenting senior services through Riverside for you today. Just a little bit about myself. I have worked for Riverside coming up on 9 years now. I'm 2 months shy of my 9-year work anniversary with Riverside, and I love it. I grew up in West Point, Virginia, so I'm somewhat local, and really got into Riverside when helping my grandmother navigate senior services for her, and just realized that I had a passion for it. And I'm excited to be with you today. In addition, Alan Varnson will be presenting with me, and I'm going to read you Alan's bio. So Alan is the Director of Business Development for Riverside at Home. He is an accomplished sales and marketing executive. He has over 30 years experience with advertising hundreds of the nation's top brands. So he's worked with brands such as Johnson & Johnson, Procter & Gamble, LensCrafters, and many others. He also leveraged Johnsonville Brats and Dawn Powder Dissolve brands, helping them secure national distribution in major retailers. And he graduated with a Bachelor of Science in Advertising from the University of Florida. And after raising 6 children in Atlanta, he and his wife Eileen moved to Hampton Roads, and they're raising several misbehaved dogs and 1 adequate cat. Sounds like a full house. So today we're going to talk about navigating senior health services. I got a call recently from an acquaintance, and she told me that her neighbor had just really had a tough time when her husband was ill, and she didn't know where to turn. She didn't know what the services were in our area, and just was not prepared for his illness. And so my friend said there's such a need for additional education, and that's what brought about this PowerPoint and this presentation today. We really want you guys to know what you have access to should something come up, and how to access those services. So we're going to talk about independent living today, assisted living, memory care, adult day services, in-home private care, home health, palliative care, and hospice, and give you guys an overview of what each of those services entails and how you can access them should you choose to. So we're going to start off talking about independent living. So this couple, Martha and Tom, they live at home. They're completely independent. They don't need any help around their home, but they're really tired of the upkeep of their home, of the maintenance in their yard, and they want to relax and enjoy their retirement. They want to be able to leave their home and travel and not have to worry about something breaking like a hot water heater while they're gone. They don't want to have to worry about burglary, and they think it's time for a move. So what are their options? Riverside owns 3 independent living communities: Warwick Forest, Patriots Colony, which is for our warrant officers and officers in civil service, and then also Sanders Retirement Community in Gloucester, Virginia. What does independent living consist of? We have 2 continuing care retirement communities. Sanders is a rental, and the continuing care retirement communities have different entrance fees and contracts. They come with a protection. Should you need any type of additional care, one of the contracts will protect your assets. And they're full of amenities. And the major communities have pools, walking paths. All of the communities provide housekeeping and garbage removal and all of the upkeep that you would want for your home, all built in. There are meals that are included, activities for you and your friends or your spouse, and it's a really great lifestyle. When you move into a community, you need to think about, does this community have a continuum of care? So I'm independent now, my spouse is independent, but what if one of us needs care later? I know that we have a lot of independent living communities in this area, but when you're looking, you need to look for one with a continuum of care, because when you move, you should be planning for your future. With a plan for your future, you want to think, what's next? What if my spouse needs assisted living or long-term nursing care? Do I want to drive or do I want to be on the same campus? Most people would answer they want to be on the same campus with their spouse. So look at their continuum of care on a campus. We have great options for a continuum of care. That way you can have a plan for your future and your children or families, not deciding that for you. And if you do have a spouse that you move with, then the two of you will be together. No matter what healthcare needs, you'll at least be on the same campus together. There is a qualification for independent living. So it's similar to you can't buy insurance, homeowners insurance after there's a fire. You need to move and protect yourself and your future when you're still healthy. So with independent living, there's a qualification, and you need to be no major debilitating illnesses that would require any type of assistance. But not to worry, they're not super picky about things like arthritis or common ailments. Mainly, they want to make sure that you can live independently within their community. So when you're looking at independent living, a good question to ask, is it for profit? Is it not for profit? We operate all not-for-profit communities through Riverside. We're 501c3. And you also want to figure out what's included in your fees. The fee structure for the bulk of our communities includes your food, your housekeeping, your utilities. Extra costs that you would assume would be, cable, internet, and a phone, if you so choose in your apartment. But you get one meal a day with the meal plan, and that's all built in. And then in addition to that, you can also use your meal points to attend a variety of entertainment activities that include meals, and you don't have to pay additional for that if you have a meal point balance. So if you're not ready for independent living, or you know someone that needs a little bit of assistance, we also have assisted living. So, and adult day services. So let's look at James. James has a hard time cooking meals. He's living alone right now. He has multiple medical conditions that require a variety of medications. And he's not able to get out and socialize as much anymore because he doesn't drive. So James's children get together. They're a little bit concerned about what's going on with dad, and they want him to be able to socialize and get out more. What are the options for James? One option that's a great option is adult day services. Maybe James' daughter says, "Hey, Dad, I want you to come live with me. And during the day, because I work, there is an option that Riverside offers called Adult Day Services. Adult Day Services is located on the campus of Warwick Forest, and it's open Monday through Friday and 2 Saturdays per month. They serve hot meals, there's medical oversight, and if you have Medicaid, Medicaid will pay for this, and if you don't, then it would be private pay. During the time that you're at Adult Day Services, there are a variety of activities, there's entertainment, there's guests, and you really develop a relationship and a bond with all the other attendees. And so if you know anyone that would benefit from Adult Day Services, we'll talk a little bit later about how to get the information for that and how to refer. But say James doesn't want to live with his daughter. He really wants his own apartment. He wants his own independence. Assisted living is a really great option. A lot of people tell us that when they move to assisted living, they're a little bit nervous about giving up their independence. And I always reassure people that it's actually the exact opposite of that. With assisted living, there is the ability to have your own private apartment, your own private bathroom, transportation to doctor's appointments. So you can schedule all of that yourself instead of going through your children or going through family or neighbors. You also have the option of going out for events and meals. There's lots of off-campus activities that assisted living at Riverside participates in. So really you become a little bit more independent because you have the ability to choose when and where you want to do things without relying on family or friends to rearrange their schedule to help you. There's no entrance fee in assisted living. You will have a community fee that's very small, but there is no entrance fee like you would see in one of the major independent living CCRCs. It is private pay. Insurance does not pay for assisted living. Your Medicare insurance pays for a doctor's visit. It would pay for rehab if you had a surgery and you couldn't go home right away. But it does not pay for assisted living. Assisted living is considered residential. And the cost for assisted living is going to depend on your level of care. So when I say level of care, what I mean by that is you will meet with a nurse, you'll have an assessment, and during that assessment, you'll discuss your needs. Maybe you need help with medication management. I've seen people that have glaucoma and they have a hard time reading their medication bottles. They're worried about taking the wrong medication, and that's all you need. That would be a very low level of care. But suppose that you need a little bit more assistance. Maybe you need help with getting dressed and ready in the morning because you're having concerns about your balance. Maybe you are concerned about getting in and out of the shower and you need standby assistance to where someone's there to help you in and out and get dried off and dressed. Assisted living can take care of all of that. Plus, they can take care of incontinence management, any type of medical condition that would require frequent checks every 2 hours. And it gives you the privacy of your own apartment. Doors can be locked, and where you can call the medical staff, they are only just a push button or a pull cord away from helping you should you need help. So good questions to ask when looking at assisted livings. Is it for profit or not profit? Our assisted livings are all not for profit. And will they have nurses 24/7? Riverside has an LPN in their assisted living buildings 24 hours a day. It's not required, but it's something that they feel provides a very good standard of care, and it's something that they believe in and they feel strongly about. And then ask to look at the activity programming. You want to know if the community has a full-time chaplain for religious services. If that's important to you, you want to know how often people get out on campus, if they go out to lunch, or if they even have a bus for transportation. All Riverside properties do have a variety of activities, and you need to figure out which ones are important to you and see if that community is a good fit for you. Next, we're going to talk about William and Sandra. So William and Sandra are living at home alone, and William has recently been diagnosed with Alzheimer's. He's starting to get confused about the time and place. He's having difficulty completing normal tasks. And then Sandra's also noticed changes in William's personality, and she starts to worry about leaving William alone. So what's going to happen when she runs to the store? What's going to happen when she goes to choir practice at church? She doesn't feel comfortable with him staying on his own. Two options for William and Sandra. One could be moving into an assisted living if his Alzheimer's isn't advanced, so the assisted living that we just spoke of, to where nurses will be available. But if William has developed a really low sense of safety awareness, he doesn't understand, not to walk outside when it's raining or storming. He doesn't understand not to put inappropriate things in the microwave. Behaviors like that, that's a good time to look at memory care. Memory care, just like assisted living, encourages independence. And that can look like, a nurse asking, hey, William, what do you want to wear today? We have these two outfits. Which one looks best to you? And William picking what outfit he wants. He could pick what activity he wants to participate in, what TV channel he wants to watch. Decisions aren't made for people. They're encouraged to make their own decisions. And we have trained staff in our memory cares that are able to use different techniques so that our memory care residents stay as independent as possible. It's a secure environment. So there's outdoor access, beautiful gardens. You can go outside, you can experience the different seasons. You're not stuck inside, but it's in a secure environment where you're not going to be able to get out of the fence and get lost. And it improves the quality of life. So a lot of the staff with their training know how to stimulate the brain, do activities that are memory stimulating. So maybe it's a remember when activity, maybe it's a music and memory program where we pull music from the time period where that person grew up. And the importance of that is to keep the person as active as possible in spite of their diagnosis. Memory care is private pay, and there are always LPNs in the building where memory care is housed. And so you're going to have a nurse overseeing your loved one's care 24 hours a day. They're going to be safe, they're going to be secure, and they always thrive in our memory care environment. So next, I'm going to hand it over to Alan. He's going to talk to you about Riverside at Home and the services that Riverside offers for staying in your home.
Thank you. My name is Alan Varnson, and as Garnet said, I have custody of a few ill-tempered dogs and a mediocre cat. I came to Riverside just 6 months and 16 days ago. So this is a new stop on my life journey. I started my relationship with Riverside as a patient. Last summer, I was diagnosed with cancer, and the consultation with the oncology group and found out that it was stage 4 cancer, which is not the stage that you want to have, and spent the summer in chemo and radiation, and Riverside saved my life. So I am repaying a life debt, Riverside, coming to work in their home care team. So today we're going to talk about the things that we offer over in home care, some of which I got to take advantage of. We'll start with Clara. Clara does not want to leave her home. She is getting on in years and is very interested in staying put. And she needs some assistance with cooking and running errands and managing her medication. And so for Clara and folks like her, we have in-home private care. And this may be something that you've already started to research. There are lots of for-profit in-home private care companies, private duty companies, sometimes they're called. And there are those that are not for profit. Riverside is a nonprofit organization. So we're different from them in a few ways, and I'd just like to point out some of those. Riverside in-home private care is part of the Riverside health system. So the folks that are providing the care for you are on the same team as your doctors and nurses when you're a Riverside patient. So you have complete continuity there, and that's a really good thing. We also offer more advanced care. So in addition to home health aides that might come out and help you with housekeeping and chores and trips to the supermarket, we also have nurses that can come out and help you with medications at all private pay if you choose to go that direction. There's another good thing to keep in mind when choosing an in-home private care company, and that is flexibility. So a lot of companies will have minimum requirements for the number of hours per week or month that you're signing up for. And you know, those contracts can be kind of daunting to read through. Riverside does not have this type of contracts. If you decide you just need someone to come to your house one time, Riverside in-home private care can accommodate you there. We get to the home health side, and this is the home health folks helped me out when I was going through my treatment because I had a feeding tube. And you know, they had to show me how to use it and came to my home and gave me the tutorial. And those are the kind of things that home health can do. It is covered by your Medicare or your private insurance, and it's for managing disease. So Clara, she had a hospital stay, and now she is back home and she is managing her diabetes. It could be for respiratory disease or cancer, or any of the other diseases that kind of come along with aging. And a lot of times you'll see in-home private care come out after a surgery, like a joint replacement or a hip. Palliative care. So when I started at Riverside, I'm ashamed to admit that after 58 years of living, I had not ever heard the word palliative care. So like any other old guy, I went straight to the dictionary to find out what did it mean and where did it come from and how is it pronounced? Some people say palliative, others say palliative. As you can see here, it started as Paul and then palliate, appall, and palliative finally came into vogue about the same time that the hospice benefit became law in America. The World Health Organization defines palliative care as an approach that improves the quality of a patient's life and their family when they're facing the problems associated with life-threatening illness through the prevention and relief of suffering by means of early identification, impeccable assessment, and treatment of pain and other problems, physical, psychosocial, and spiritual. I think the real way to think of palliative care is an extra layer of support if you are going through a difficult medical time. So the palliative docs do not replace your physicians. You would still have your primary care provider. And this would just be in addition to the team. So in Clara's case, she is on dialysis, and this can continue during palliative care. This is not a hospice benefit, so she does not have to stop any curative treatments that she's going through. And that extra layer of support is there to keep an eye on her and check in with her and make sure that all of her symptoms are being managed. Another good way to think of palliative care is sort of the other side of the coin for curative care, where curative care might be very specifically disease-focused. Palliative care is more treating the whole person. So all doctors have a measure of palliative care that they provide, but palliative specialists really focus on how you're doing as a whole person. And finally, we come to a collection of benefits that has the unfortunate title of being hospice. One of the challenges, as a marketing guy, I look at hospice and say, what is it that we are trying to accomplish? Where is the problem we are trying to solve in bringing hospice to more patients more often? And there is a big stigma attached to the word hospice. Even though it's rooted in the word hospitality, people cringe. A lot of people don't like to even say the word hospice or discuss it with their physicians. A lot of physicians are reluctant to bring it up because it crushes hopes of their patients. And so we are working to try to destigmatize hospice. And when you realize that hospice is an incredible resource of benefits that we earn over the course of our lives, that a lot of us will not fully utilize. And you ask yourself, why do we leave these blessings on the table? And it's because we believe choosing hospice is choosing not to live, but nothing could be further from the truth. Choosing hospice is choosing to live the rest of your life on your terms. Hospice is designed to minimize pain, to reduce the suffering of fear and worry, and the burdens of care that are placed on families when a patient is having a difficult medical situation. One of the benefits of hospice that a lot of people don't even know exists is a benefit called respite care, where the hospice agency would take your loved one into a facility so that you, as the family caregiver, have a chance to kind of recharge your batteries and recover. Hospice has no requirement that your life ends. Every day in America, thousands of people graduate off of hospice because their situation improved and they no longer require the benefit. Hospice has a even greater emphasis on emotional and psychosocial and spiritual support for patients, as well as their family members. And the hospice benefit is designed to last for 6 months. So The only requirement for hospice is that you have a prognosis for 6 months or less, but there is no requirement that it stop at 6 months. We have many patients at Riverside that have been in hospice care for years, and the benefits that they are receiving are tremendous. I want to introduce you to 3 folks that work at Riverside and are really wonderful and compassionate. If you do anything today, store this phone number in your phone. One of these 3 folks will answer when you call, and they can answer any questions about what Garnet and I have discussed today. If you are watching this video, or if you are attending here in person, chances are, kind of like me, your life journey wandered off into a patient journey. And there's a reason why we start exploring and investigating these resources. One of the greatest gifts that you can give to your family and that families can share with each other is their wishes. And so if you have not already done so, please take a moment, visit riversideonline.com and complete an advanced care directive. And what this is a document that becomes part of your medical record. It can be edited and amended anytime you change your mind about anything, but it lets everyone know how you want to be treated when the day comes that you might not be able to speak for yourself or express your wishes clearly. My mom is 90, and she is in Pensacola, and I, having hyper-focused on these benefits since coming to Riverside, started talking with her about what are her wishes, and does she want to stay in her home, or does she want to start looking at a facility? And she told me that on her 91st birthday, she wants to try sumo. And I thought, is that like Tai Chi? And she said, no, I just want to try a sport where you don't look ridiculous wearing a diaper. Okay, Mom, that's your wish. But we have completed, our family got together and we all completed advanced care directive, not just for her, but for all of us, so that everyone knows this is how I want to receive care at the end of my life, and deal with things on my terms. And he is also now under the care of a palliative doctor down in Florida, because one of the things that I discovered in my exploration of this information is that the worst thing that you can do for a senior citizen is admit him to the emergency. So if you want to be surrounded by flashing lights and beeps and tubes and wires, then go to Vegas, where it's a lot more fun. But emergency rooms are just not a great place for old folks to hang out. And so I encourage my mom to get him enrolled with a palliative care physician, because they are really, really expert at managing some of the symptoms that might send you to the emergency room, but managing them at your home. And so that has been a great benefit for us. And it just takes so much of the stress and worry of what happens next out of the equation. Thank you very much for your time today. For Garnet Gilmore, I'm Alan Varnson, Riverside, and enjoy your day.